Welcome back. Thank you for coming back to DLC if you were with us earlier this morning. And if you're just now tuning in, welcome, welcome. We have a lot of fun things that we're going to cover over the next hour or so. So bringing you live this hour, we're going to be talking about Alta MD products. So I'm going to run through these products with you. And we're also going to then shift gears to something very exciting, one of our new devices here at DLC, which is the BBL Hero. You're going to get to see the BBL Hero live, which is not something we can ever do during a live event. So we're finding the silver lining in the virtual event by definitely being able to see these particular procedures live. So we're going to take you in the laser room, we're going to put our goggles on together, and we're going to watch some BBL Hero. Right now, though, I really want to kind of dive in to the Alta MD products. If you are not new to the dermatology world and the skincare world, you probably know about Alta MD. Alta MD has been around working with dermatologists for many years, and they've always really put the tolerability component as their #1 care in their products. And so people can tolerate these products even with very sensitive skin, and so they're really, really, really effective. Really, their niche in Alta has been sunscreens. They really pioneered the mineral-based sunscreens and making them cosmetically elegant, and sunscreens that don't irritate your skin or clog your pores. I've just pulled a few out of our shelf that I can talk about right now, but know that we have many more products that I'm not even going to go into detail about today. I'm going to talk about a few that are really my personal favorites, and that's really how I tell my kids, like, if you're trying to figure out what birthday present to buy someone, buy something that you like. So I'm going to talk about things that I like. One of my favorites is the UV Active. It is one of their newer products in that it's a 100% mineral, so only zinc and titanium dioxide sunscreens, which are essentially ground up rocks. Like, they totally reflect the sun, and it's totally waterproof. So it's the UV Active. And one of my favorite parts about this particular sunscreen is that you can really squirt it in your hand and rub it all over your face. It does not burn your eyes under any circumstance. So if you are looking to put sunscreen on a moving object, otherwise known as a child, it's really hard to beat this particular sunscreen. It stays on, it does not burn the eyes. It also comes in a very large size, which is also very effective, especially if you're kind of going on vacation. We also have UV Sport, which this is one of their older products. It's really, really popular. It's a translucent zinc oxide, so it has zinc, but it's totally, totally translucent, and it's totally sweat-proof. It goes on very clear and sheer, which is also makes it very popular. Another one of our favorites is a spray zinc. So most sunscreen sprays that you see widely available at drugstores and kind of bigger stores are the chemical sunscreens that they can really burn your eyes. They also leave a kind of a type of film on your skin that can be unpleasant. This is an all zinc spray, so that's very, very unique, so it also doesn't burn the eyes. Okay, I've also highlighted the So Silky hand cream. This particular hand cream by Alta MD was actually tested among healthcare workers. So study members were putting the hand cream on in the morning and then having to wash their hands throughout the day at work, and it was able to survive all of those hand washes. And so this is one of my favorites. It's also really one of my favorite gifts to give because, again, I know that I really like it, and people are really surprised that this can withstand hand washes and is totally device friendly, so you can put it on and it doesn't streak up your devices. Then I also include the PM therapy and AM therapy. These are really light moisturizers. They're great for acne-prone skin and our teenagers. The PM is a little bit more moisturizing, especially those that are kind of trying to get acclimated to their acne regimen that sometimes can cause some irritation initially, but then goes away. And then they need additional moisturizer in the morning that, again, it's very light and doesn't clog the pores. Which then brings me on to the UV Clear and UV Daily, with two of Alta's first products. The UV Clear and UV Daily are both mineral-based sunscreens, but they are really meant for everyday use. You put them on, you cannot see them, you cannot feel them. So for even the most sunscreen-averse people, they actually will like the Alta UV Clear and UV Daily. Which brings me on to the next thing that's very exciting, which is our Alta MD raffle. We have a lot of products, all by Alta, that will be raffling off. And what's really, really great is that there's also, oh my gosh, 50 units of Botox in there. So this is a really fantastic raffle that showcases many of Alta's products with some added bonuses. So with that, I'm actually going to transition on to Leanne, and Leanne's going to go through some of the exciting things that we're going to be showcasing this next hour. Okay, welcome, Leanne.
Hello again, it's me, Leanne, your favorite PA. Now, welcome back to our 1 o'clock hour. As a reminder, you can purchase an event voucher today and tomorrow. That's a $250 deposit that guarantees you our event-only specials until November 13th. Now, those specials, as a reminder, are 10% off a package of treatments like BBL, Genius Skin Tightening, or Skin Pen Microneedling, and 20% off single treatments. That's Botox, Dysport, Halo, laser hair removal, whatever you can think of, we have it here. Chemical peels, those are a great one. And I want to review the exciting things that are coming at this hour. So we have our BBL Hero. Again, that's the latest and greatest technology using broadband light, which is a stronger cousin to intense pulse light, or IPL, to treat the entire body. Now, it's great for treating reds and browns on the entire body. We're also going to be doing some Prejuvenation with Botox for young professionals, talking about color science, and then demonstrating our Skin Pen, which again, if you purchase an event voucher, you can get 10% off a package of 3 Skin Pen treatments as long as you start your first treatment before November 13th. Now, let's talk a little bit more about this Delta MD raffle. Okay, so you get this lip SPF, okay? I think the lips are a really slept on place that we need to have sunscreen. So this lip SPF is zinc and titanium. It retails for only $10, okay? That's a great way to protect your lips for just about 10 bucks. And this tube lasts forever. It's my dad's personal favorite because he always needs lip SPF. So just one of the amazing things that come in the Ultra raffle. Now you also get this really fabulous bag. So I'm gonna just take out the bag because I want you to see it. So let's take it out, okay? Whoever wins this raffle is in a great place. You get this awesome bag. Jill's eyes are terrified because I'm messing up her beautiful basket. Okay, look at this bag. Talk about a quality canvas beach bag that will store all your Elta products and sunscreens as you head to the beach. Now, you get a UV Active, again, great for vacations. This is the larger size of the UV Active, an all mineral SPF. It's also reef safe. So when I traveled at least recently, I did use this sunscreen because it is reef safe and not dangerous to the environment. Okay, so you also get 50 units of Botox. Okay, that's a great Botox treatment. 50 units of Botox, we can treat a lot of areas. Forehead, glabella, in between here, there's 11 lines. Crow's feet, eyebrow lift, lip flip, and the depressor ampullite worse that turns the corner of the mouth down. All that we can treat with 50 units of Botox. So totally great raffle to enter and win. Now, we do have a So Silky hand cream and an AM and PM therapy set. AM and PM therapy are a little bit different, but they're both great moisturizers. And I think AM and PM is a little bit of a misnomer because you can use either of these moisturizers in the morning or in the night. It's just a matter of which one is your preference. That's why we carry so many different products here, because we have something for everyone. And again, that So Silky hand cream, this is the best hand cream, especially around the holidays. It's gonna be cold soon, fall and winter weather is coming. You're gonna need some hand cream for those cracked hands, especially because we're all washing our hands a million times more because of the coronavirus pandemic. Hello, Emily Sheffield, thanks for tuning in. All right, now, I mentioned that you get 50 units of Botox when you win this raffle, but you also get a Vitalize chemical peel. Now, a Vitalize chemical peel is a great peel for skin brightening. It is a proprietary solution, and it's actually 2 steps of the peel that is done by Carly, a nurse practitioner, or myself, and it kind of tingles in a crescendo, decrescendo fashion. You kind of feel the heat, and then by the time you leave, the heat is gone. And it all depends on your kind of personal healing capacity for the skin. Some people peel a lot, some people don't peel at all. Your peak peeling with the Vitalize peel is about day 2. So it's a great procedure for a Thursday or Friday. You can wear makeup on Monday back at the office. Now, Vitalize peel plus the Botox and all these Elta products is valued at over $1,400. So this is a really incredible special to win. All these amazing sunscreens, moisturizers, a Vitalize peel, which is safe for any skin type. Thank you, Lena. I totally agree. This does sound awesome. Vitalize chemical peel and Botox. Yes, we want all those things. Thank you so much. So in order to enter for this raffle, you do have to purchase a product this week. Now, as a reminder, all of our products are 20% off. So if you want to be eligible to enter, I'd like you to please call us, schedule a curbside contact-free pickup for whatever product you need. Now, also, every product you buy is one entry. So if you buy 5 products, that's 5 entries. You're more likely to win. Let's see what else we've got in this raffle. Okay. Ooh, foaming facial cleanser. Okay, a great cleanser. Now, foaming facial cleanser is really great because it has a nice foam, but it won't dry out your skin or strip your skin. So I think this is a great product for anyone who's new to cleansing or likes that foaming feel. You just need about a pump, wash it on your face, and rinse. This is also pH balanced and oil free, so it's really great for anyone with acne prone skin as it contains no oil. We are going to head over to the procedure room where Carly and Dr. Adigun are doing the BBL Hero. Again, so exciting. This is advanced technology. Hey, Carly, Dr. Adigun, and our patient, thank you.
I think because that background's back there.
Oh, no, there we are. Hello, welcome. Yes, we're going to be talking about the BBL Hero. This is very exciting. This is the newest device at DLC. And if you've had a BBL before, imagine a BBL that's even more powerful and easier to treat even on the body because of the speed that it's able to fire safely. So we're going to actually be showing you a live demonstration in the BBL, which we usually can't do at a live event, but we'll be able to do that today at this virtual event. So the BBL Hero is a light-based device, which means that it actually emits a band of light, and using different filters, we decide which band of light we want the patient to transmit onto the patient. And we choose which band of light based on what we're trying to treat. So, and the skin type of the patient. So we're actually able to treat safely all different skin types with BBL. And with our patient here today, we're actually going to be treating pigment and redness. And so when we see kind of a mixture of light spots and dark spots and red areas, that's called poikiloderma. That happens very often on the chest. We sustain really severe sun damage on our chest. And part of it has to do with its perpendicular nature to the sun, just like the bridge of your nose. Your chest is about at a similar angle. And the quality of the skin on the chest is really quite thin. And so it's not able to remodel as effectively as other areas of our body. And consequently, it sustains a lot of sun damage, which a lot of it we can fix with BBL. And so that's what's so fun. So now, the first thing we're going to do is cover her with some gel. Okay, and why do we use ultrasound gel? Well, the ultrasound gel allows the laser crystal to maintain constant contact with the skin and glide smoothly and transmit evenly over the skin. We're going to be doing several passes of the BBL using a couple of different filters so that we are able to tailor which aspect or which target in the skin we want to correct. So, typically speaking, we prefer the patients to not be tan when we're doing BBL. And the reason for that is because if you are tan, that kind of pigment that's sitting on the very top of your skin, that is really your body's attempt to protect itself, but really is an evidence of DNA damage. So we're like a big no-no with tanning, but it happens, right? And if you are tan, then we want to wait until that tanning sloughs off so that the BBL can penetrate more effectively and we can turn the settings up so that you can have the best treatment possible. So we prefer that you not be tan when we do your BBL. So again, we're putting plenty of gel on. Popular areas to treat with the BBL Hero are the chest, the shoulders, the neck, the arms, the forearms, the hands, the legs. We're treating all over the body with the BBL Hero, and patients are loving it, and so are we. And what it's cleaning up is that sun damage look, a lot of those brown spots, and some of the kind of the modelly vascular stuff, that's vascular sun damage. It really makes everything look nice and uniform again, just like your more youthful skin. So I've got a question here. Can this be used on all skin types? BBL can safely be used in all skin types in the hands of the right provider. So here at DLC, we pride ourselves in being able to take care of all skin types, all levels of pigment, and all ages. And so that's something that we stay very current with so that we can deliver the best care to the DLC community of patients. So why don't we get going, Carly? Okay, so we're getting our goggles on. do have to wear safety goggles when you're using the BBL. And I'm going to kind of talk through this while Carly is actually carrying out the BBL so that one person can focus on the patient and one of us can focus on talking about what's happening. Okay, so the first thing she's going to do is, of course, turn it on. We will have already discussed the settings ahead of time based on how the skin is presenting that day. So you have a totally customized treatment depending on what your areas of concerns are and what type of skin that you have. Typically speaking, we do bring patients in to numb beforehand with a topical numb gel that we have you leave on for at least 30 minutes. That being said, you don't have to do that with BBL, but it does make the experience a little bit easier. That being said, again, there's plenty of patients that do forego the numbing. And so Carly and I already discussed what treatment levels that we're going to be doing. And all right, Carly, let's do it.
Okay, you ready?
Okay. Just as Carly gets going, then I'm going to address as the questions are coming in. Okay. So how many treatments are recommended? That's a really great question. And a lot of times we typically recommend preparing yourself for a few treatments to get you to full correction. Now, does that mean that some people need a few more treatments to get to where they want to be? Sure, but I like to have the idea that we can go about each treatment as safely as possible and not try to cram everything into one treatment because that's when you don't necessarily get the best outcome. So now you can see she's going up and down across the chest here. And what's happening with this particular filter is a lot of the vascular damage or the vascular sun damage that causes your chest to look red. This particular filter is leaving the wavelengths to concentrate on that. And so what happens is the little, what's called hemoglobin, which is a molecule in red blood cells that's kind of sitting in the surface of the skin, will absorb that laser energy and cause that tiny little vessel that's doing nothing but make you look red to be absorbed by your skin. And then it's gone. We do recommend maintenance treatments with BBL after you've achieved your desired correction. And what that will do is prevent further aging of the skin over time. And now there's no one regimen for BBL maintenance management. And that some people really, especially if they have a propensity to turn red, for the face especially, we do recommend coming in several times a year so that that redness does not come back. On the body, it's more like once or twice a year, really to make sure that skin stays healthy. Over time, BBL treatments can actually stimulate collagen and prevent aging in the skin with regular treatments over time. And yes, another question, can Pronox be used instead of numbing? And the answer is yes. People that are tight on time, want to walk in here, have their treatment and go, but want some form of pain management, Pronox is an excellent choice in that circumstance because Pronox works instantly and wears off in less than 5 minutes. You get in your car and you drive home or drive to wherever you could drive to right now. And so yeah, now we're going to do a second pass. And this is exactly what you would experience if you were coming in to have BBL on your chest or on your neck or your arms or your shoulders or your hands. Now we're going to do another pass here. You can see Carly's going in another direction. How long does the treatment last? That's a really great question. A lot of that has to do with you and that how good you are with maintaining your investment as far as protecting your skin from the sun. So really, where BBL gets you in that moment, that's yours. That's yours to keep. That's yours forever. However, the aging process continues, and we do continue to get some level of sun exposure. So typically speaking, you're going to want to do it again if you want to keep your skin looking as good as it did after that first treatment. So this is another great question with BBL. Is there any downtime? I frequently use the term recovery period instead of downtime because much of what we do here at DLC, these are all non-invasive treatments, and so there is no true downtime, but there's often a recovery period. But with BBL, there's really hardly any recovery period at all. What our patient will experience today will be her red areas will look redder, her brown spots will look browner, and that will last on the body, on like the chest and the shoulders and the arms, as long as a couple of weeks. But the surface of the skin is never compromised with BBL, and so as a result, there is no real recovery. You're not wounded at all. The color is just a little bit, it's like a little bit exaggerated for a couple of weeks. And what's happened is that the wavelength that we're about to do next is going to target the pigment in the skin. And so those pigment particles that are sitting in the top layer of the skin, called the epidermis or the superficial dermis, it's going to absorb that laser energy and cause those pigment particles to fracture into tiny little pieces. Then they're going to sit in the epidermis, and we have to essentially wait for them to get to the top and slough off. But there's no peeling from BBL, no sloughing from BBL. They'll look like little coffee granules that are going to slowly work their way to the top and slough off. Just as the skin renews itself once a month, no matter what, everything's recovered in about 2 to 3 weeks. Post-procedure products to use, absolutely. We typically recommend to really optimize your treatment as well as optimize your recovery period is a product known as the Elastin Nectar. The Elastin Nectar can actually be applied several days before your treatment and during the entire recovery period. All right, so now we're doing the third pass. And depending on the skin type and how much energy that we're using, we may do 3 passes, we may do 4 passes, and sometimes we may even do 5. It really just depends on exactly what our goal is for each individual patient. And you can see our patient is just fine. She just did a little bit of numb gel. Did you even do any numb gel? She did not even do any numb gel, and she's doing just fine. So there's this treatment has a lot of flexibility, especially on the body. It does not tend to be as uncomfortable as compared to the face. And so it is really, really common for patients to come in and have like their full arms treated, their hands treated, or their chest or their upper back. Anywhere you've had a lot of sun damage, you want to clean that up. The BBL Hero is really effective for those particular treatment goals. And you don't have to numb. And so from a time constraint, or what we like to call lunchtime treatment, BBL is really ideal in that circumstance. Any other questions coming in here? Okay, so yes, what age is best to start BBL? That's a really great question too, and a lot of times it has to do with what kind of skin concerns you have. I have plenty of patients that start BBL when they're 16 because they have a lot of red acne scars. I'm going to just take one moment and take a peek. She's having a nice tissue response here. You can probably do one more pass. One more pass. We're going to do one more pass. And so, so we have patients that start BBL in their teen years to correct pigment irregularities that may have been caused by sunburns, but most often by acne. BBL is really a foundation treatment for treating acne scars. Much of what makes acne scars look especially bad is the redness or the pigment. And so correcting that can really make a massive difference for the acne scars. Then as they get older and you start having early signs of sun damage, then we transition to BBL at that point in time. So there's no one time, you're not too young for BBL. We use it on BBL for scars on the body, and that we could do even in childhood. So there's a lot of flexibility with BBL. It's also really the gold standard of treatment for rosacea, which is a disease where you have a lot of redness in your skin, and it can even kind of flare up and kind of come and go, that kind of flushing. And I have a lot of patients come to me and they say, I'm sick and tired of being the red person in the pictures, of my red nose in the pictures. And this is just as common in men as in women, if not even more common in men. And this is the gold standard treatment to really get that redness under control. So can BBL be used as a preventative treatment? Absolutely. So BBL is used as a preventative treatment. I mean, even for patients that come in initially for corrective treatment, and then we get them to goal, then we transition to maintenance. What is that maintenance for? To continue that collagen stimulation and to continue to keep the skin resilient and clear. And what that will do is prevent that aging process over time and augment the aging process over time. All right, she looks great. Does BBL help with white spots? Okay, complicated answer to that one. So the question was, does BBL help with white spots? So what are the white spots that develop in our sun damaged areas? It's really common on the forearms. You'll see it on your legs, especially on the lower legs, areas where you may have tanned in the past. BBL can help, but I'm going to explain exactly how because it's different than the way we treat a brown spot. So those white areas are areas of what we call pigment dropout, essentially where your skin cells have just, your skin pigment producing cells have just pooped out. You've gotten tan many times and they just can't do it anymore. And they're just like waving their white flag. We cannot tan anymore. We are super duper done. But it can be rather disfiguring, and some patients are really distressed by this condition. Has a fancy name called idiopathic cutis hypomelanosis, very long name for a benign disorder. But it's benign in that it's not dangerous, but it is not benign in that it can be very distressing. What BBL does is cleans up the brown hyperpigmented areas around the light areas, makes your skin more uniform, and therefore makes those light spots a lot less noticeable. All right, Tracy, let's have you sit up so we can show what your chest looks like. So her brown spots look browner. Her red areas look redder. And this is our first treating Tracy. And so the next time we treat her, after learning her skin this first time, a lot of times we can push the settings a little bit further to get her closer to goal. Again, it's a long-term relationship to get aesthetic procedures like this right for each individual person's skin. We really have to customize because everyone's skin interacts differently with each device. Next question is, can you do Botox and filler the same day as BBL? And the answer is yes, we do. In fact, it's pretty common for us to do BBL after filler or BBL before Botox. That's a really common kind of sequence because we know that you're busy and we know that you have jobs, and you have families, and you have responsibilities. And we want to get as much done as we can when you come in here, especially for my patients that travel really far to come to DLC. We try to really make it as effective and efficient as possible. In the order of operations, we do your filler first, and then the BBL comes second because that BBL can help clean up any potential bruises that you may have developed during your filler placement. And then when it's all done, we clean you off and you do your Botox and you're out the door. All right, time to go to Leanne. Leanne's going to talk all about what we're doing here at DLC for prejuvenation in the millennial population. All right, take it away, Leanne.
Hello, it's me, Leanne, and so we are here with Lindsay, our young professional millennial patient who we're going to prejuvenate with Botox today. So let's talk a little bit about what we are going to do. I have already marked it as an easier way for everyone to see at home. So first, we're going to treat her frontalis muscle, which is a big flat muscle that stretches all the way across the forehead and creates these horizontal lines. Raise your eyebrows up, please, Lindsay, and relax. And so my goal is to soften the appearance of these lines while still preserving her natural movement. So the frontalis muscle also controls our eyebrow lifting. Raise your eyebrows up again, please. Perfect, and relax. Now, this is the area that we in dermatology call the glabella. And there's actually 3 different muscles that control glabellar movement. The procerus, the depressor supercilii, and the corrugator, which goes all the way out here. So this is actually one of the most unique areas to treat because a lot of people's glabellar structure is a little bit different. So put your eyebrows together for us so you can see how she has, these bulging muscles that we are going to soften with Botox today. And I'm also going to treat this little bunny line that she's getting right here. You can relax. Oftentimes with maturity, we do develop this little wrinkle right here. And so by using just a small amount of Botox, we can really soften that. So why don't we get started with these areas, and then we can move on to some other areas around her eyes and her lower face. Okay. All right, let's see. You're going to feel pressure from my finger here and stick. Pressure and stick. See, it's a pretty quick process. How's your discomfort level with those first 2 injections?
I barely noticed it.
Yeah, wonderful. Let's continue. Pressure and stick. 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 Pressure. Stick. Perfect. Let's move on to her glabellar area. Pressure Other side, please. Okay, so let's talk about a few things that you may have noticed so far. These little fluid collections of product will go down in about an hour, maybe 15 minutes. And all neuromodulators like Botox, Dysport, and Jeuveau, we're using Botox here, are powders. And so we actually have to reconstitute them into a liquid form to be able to inject them. And so you'll notice immediately after injection are these little bumps that look just like mosquito bites. And again, those will go down in about 15 minutes to an hour maximum. The next thing I'm going to do for Lindsay is what's called an eyebrow lift. Now, a neuromodulator or Botox brow lift just helps open up the eye a tiny smidgen. It's, a millimeter, but it can actually help you look more refreshed, like you got more sleep, even if you didn't. This is one of my favorite treatments to perform because it just subtly enhances the brow and lifts it up in a very natural way. All right, let's do that. All right, pressure here, and stick. And other side. How you doing? Good. All right, wonderful. We're going to move on to crow's feet. Now, smile, relax. Crow's feet are the number one reason data shows women seek out neuromodulators like Botox or Dysport. So with just using 3 injections, I'm going to help soften these lines and prevent them from becoming permanently etched in. Perfect. And let's do the other eye. Smile, relax, stick, stick, stick. All right, perfect. Let's move on to the lower face. As you can see, I have marked Lindsay's lip, where I'm going to inject the top of her lip for what's called a Botox lip flip. What this does is it stops the muscle on the top of the lip, the orbicularis oris, from contracting. And so it will be a very, very, very subtle enhancement of the height of her lip. This is a great procedure for someone who has smoker's lines, straw drinking lines, or anyone who just wants a very subtle enhancement of the lip without getting lip fillers. This is a great way to start. So I like to use an individual syringe for each injection across the lip, as the skin tissue is very delicate. Okay. All right. Pressure here. Stick. Stick. Perfect. 2 more. One more on the lip. All right, last one for that fabulous lip flip. Okay, so the last thing I'm going to do is inject her depressor anguli oris, which is the muscle, this big triangular muscle that controls the downturn of the mouth, okay? So show me your bottom teeth, Lindsay. It's this big muscle right here. We're just gonna put a little bit of neuromodulator to help keep her mouth upright. And other side. Hey, that is it for your Prejuvenation treatment. Lindsay, how do you feel?
It was great.
It was great.
It wasn't bad at all.
Wonderful. Well, I'm so glad, as you can see, it's a short procedure to really help
that these soften these etched-in lines and prevent wrinkles from forming up, because the best wrinkle is one you never get. And so she'll see results with Botox in about 2 weeks' time. And I really like to tell patients, wait the full 2 weeks before considering adding any more. You will notice some benefit in advance of that 2 weeks, but before we add any additional Botox, I like to give that full 2 weeks time for it to settle out so you notice the maximum benefit. Do we have questions? Is Botox less painful than filler? I think yes. I've personally never had filler, but Botox is a tiny, tiny needle. It's an insulin syringe, whereas filler is either done with a cannula, which is mildly uncomfortable, or a slightly larger needle. Botox is also going right into the muscle instead of deeper compartments of the face where we're putting filler. So I do think Botox is less uncomfortable than filler, but for filler we use numbing gel, versus for Botox we don't use numbing gel because it's so fast and the needle's so small. How many units of Botox were used here? This was 65 units of Botox. Great question, Lena. And so this lip flip is 5 units of Botox right there. So that's just 5 units. So that's a really great treatment if you're interested in getting started with Botox and want a result that is not quite the same as filler and very subtle. And I used 7.5 units of Botox around the crow's feet, and then 2.5 in each side to do the brow. I also placed about 15 units of Botox in her glabella area. Now that's less than that's indicated because I also treated the bunny lines for 5 more units. So the total of 20 units here is what's FDA on label for Botox. Do you recommend Botox in all these areas for millennial, or is it patient dependent? That's a great question, Sarah. Botox is completely customizable to your needs and goals. So perhaps we are only interested in treating our frown lines and our glabella. That's totally fine. You can treat this area and leave the forehead totally alone, which we do all the time. The beauty about DLC is that any of our providers, Dr. Adigun, Carly, or myself, will create a custom treatment plan just for you, dependent upon your goals and your anatomy. I want to tell you that you can never treat the forehead and skip the glabella, because you may remember there's 1 flat muscle that controls this and 3 muscles that control the movement here. Frown again, please. Relax. And so if we treat this and skip this, you will get recruitment of more lines kind of over here. Okay, we have another question. What is the difference between Botox and Dysport? That is a great question. Botox and Dysport are competitors. So Botox was first to market, Dysport was second to market. It's kind of like thinking about a Kleenex versus a Puffs tissue. They're both tissues. One of them is a Kleenex brand and one of them is Puffs brand. 1 Botox unit is about 2.5 Dysport units, so the units aren't quite the same, but ultimately they're just competitor products, but they're both a type of botulinum toxin that is safe and approved for the FDA for use. Any other questions? You'll have to post a before and after picture once we can see the results. Completely agree, Heather. I will totally post a before and after picture. We have all the befores, and so in about 2 weeks from now, we will share her after pictures of each area. Thank you so much for tuning in to my millennial prejuvenation with neuromodulators. Now we're going to go to Dr. Adigun to talk about one of our skincare lines, Color Science.
Yes, that was great, Leanne. Thank you so much. I think that you did a great job kind of illuminating just how customized our treatments are here based on your age, your skin needs, and the skin type that you have. And whether it's a younger patient or it's an older patient, we really can fill those gaps, and the needs do change over time. But very exciting, I am going to be talking about another one of our skincare lines here at DOC, the Color Science line. I'm going to highlight some of the products and really kind of tell you how they may work for you or differ from other product lines that we have. I'm going to start with 3 of them. Really, Color Science is really changed the landscape of the sunscreen, for sunscreen, in that they really create very cosmetically elegant products that oftentimes can take the place of a step in your kind of makeup routine. And so I'm going to talk about these 2 first because they really target certain problems or certain corrections that you may need in your skin. So even up is specifically a pigment corrector. There's a lot of different pigment disorders out there. 2 of the most common are what we call post-inflammatory hyperpigmentation, which is after you get a blemish or a pimple, it leaves a brown spot behind. or melasma, a very common pigmentation disorder that really affects all skin types. And so Even Up has brightening agents in addition to iron oxide, which blocks any type of pigment-inducing light, which extends beyond the UV spectrum. It includes blue light as well as incandescent lights. So that's Even Up. It also takes a very small amount, and it serves almost like a primer if you want to include it in your makeup regimen. Similarly, we have also something called All Calm. All Calm is specifically for skin that tends to develop red areas and red spots. So think rosacea, or you get red spots behind after you have acne bumps or different types of blemishes in the skin. And again, it makes a very clean finish as you are has more of like a makeup primer type feel. Now I'm going to shift gears and go to some of my personal favorite products that are part of my skincare routine. I love the Color Science Total Face Shield. Total Face Shield contains the EnviroScreen technology, so it actually has antioxidants integrated into the sunscreen itself. If you know me, I'm always doing a million different things. So if I can streamline any aspect of my life, I will, and the Total Face Shield allows me to do that. It comes in 2 versions. It comes in a glow. So the glow, this one's the glow. This is the Total Face Shield with a very light, almost like liquidy type texture. It also is good for all skin types, so it looks a little bit light as it goes on, but it soaks in and is friendly to all skin tones. The glow has a little shimmer to it, so if you want like a little bit of extra luminescence, the glow allows us to do that. The 2 other products, of course, are the brush. This is one of my favorite gifts. So this is the Color Science brush. It's heat stable. You can leave it in your car. So if you are driving the car, you need to put some sunscreen on your face, or it's time to reapply, or God forbid you get your kids to school and they need sunscreen, then you have it right there. I love the Total Eye. It not only helps with pigment and puffiness, but it has a concealer built into it as well as a sunscreen. So this is specifically for eyes. So those are some of my favorite products with Color Science. And then of course, even more exciting is that our next raffle, look, is a Color Science raffle. So yes, in this raffle we have lots of Color Science products, and looks like Dysport as well as Restylane Kiss. So I'm going to go ahead and welcome Leanne. She's going to be coming on in and telling us about what's up next.
Hello again, friends. Thanks so much for joining us. I'm so excited. Thank you for watching me do the live Botox injections. That's really exciting. So we did talk live about the difference between Botox and Dysport. Now, if you win this raffle, you get Dysport units. And I love Dysport. I use it all the time. I use all the neuromodulators, in fact, because I think they're all great and they all have a place. Dysport does have a little bit of a faster onset than Botox. It starts to work in about 2 days, and your maximum result is about a week. And so if you're like, I have an event next week, Dysport is a great neuromodulator for you because you will see that onset of action in time for your event in 1 week. I agree, Rick Struder. This is a nice raffle prize. Thank you for your comment. Now, you also get the Even Up in this raffle prize, which is a sunscreen that also works to help reduce brown spots while you wear it. So this is really more of an active treatment as well as a daily mineral SPF. Then we have that Sun-Forgettable Total Protection Face Shield Glow. Okay, this is one of Dr. Adigun's favorite products because it blends really well on all skin types. And I mean, who doesn't love a little shimmer? We could all use that in our lives, especially right now. Ooh, something exciting in this raffle. Restylane Kiss, that brand new filler that is designed for the lips. This is a really soft, subtle filler, and when we're doing the injections, patients say, it just feels like my own lip. It doesn't feel like I have, added something artificial or strange. It just feels naturally like your own lip. So you want to win this raffle. Also, there's a cute bag in here. Of course, Jill is always so cute with these raffles. So you get this cute, little wristlet. And as a reminder, in order to be qualified for these raffles, you do have to call us and purchase a product today or tomorrow. Anyone who's purchased one of our products at 20% off this week is eligible to be entered in a raffle. As a reminder, the grand prize raffle, which is Botox or Dysport for a year, that's 4 treatments over the course of this next year, you have to purchase an event voucher to be entered into that raffle. So if you'd like to be entered, please purchase an event voucher by calling us at 919-942-2922. Next, one of my favorite procedures is coming up, which is the skin pen microneedling.
That's great for acne scars, hyperpigmentation, melasma has good evidence. And so we're ready to go see Carly and Dr. Adigun to demonstrate the Skin Pen live.
Here we
Hey, guys.
are, that's right. So yes, I'm Dr. Adigun. I feel like it's important behind the goggles and the mask to reintroduce. I'm Dr. Adigun, and this is Carly Wagner. She's our nurse practitioner and extraordinaire at just about every single thing that she does. And so we're going to be doing Skin Pen. Actually, more accurately, Carly's going to be doing the Skin Pen so that she can totally focus on our patient here, Diana Gomez, one of our all-star clinic team members, while I tell you all about the Skin Pen, what it's about, and what's happening. So we can go ahead and get her prepped and get started. So this is a procedure where you'll actually come in and you numb beforehand. We do have put numb gel on your face, and that takes some time. Numb gel really works better the longer that you leave it on. So we typically recommend about a half an hour before the Skin Pen. Skin Pen is the name of what's called a microneedling device, or a traditional microneedling device. You can hear it, it's moving. That tiny little tip has many, many tiny little needles, and those needles are not hot. They're not, there's no energy flowing through them. And that actually gives another layer of safety to this particular device. It is going to, these tiny little needles are moving in and out. We determine just how deep they're going to go and how many passes that we do in any one area. And so we have a nice smooth glide so that device is moving those needles in and out of the skin. They're tiny little needles, and she's moving them around in an area. What is microneedling for? We use microneedling for acne scars. It's a great treatment for acne scars, for more superficial acne scars, newer, younger acne scars. It's actually one of the, there's only a couple of treatments here that we can do over active acne, and one of them is BBL, and the other one is microneedling. And it's going to be stimulating, again, it's a collagen stimulation, as well as providing little, tiny little openings to pull pigment out of the skin. So if you have superficial pigmentation disorders such as pigmented acne scars or melasma, the Skin Pen is an excellent choice for you. Another nice feature about the Skin Pen is that the recovery period, if you will, is very brief. And so if you want a treatment that's going to really tighten up your pores, give you a beautiful refresh, as well as stimulate collagen, but you only have a short period of time to recover, then the Skin Pen is a really great choice for you. Really what you would expect is if you have lighter pigmented skin, you're going to look red for about 36 hours and a little bit peely for another day, and that's really it. So it's a very common, Friday afternoon treatment, because by Monday you're 100% recovered. We can use the Skin Pen on all skin tones. No matter how little or how much pigment you have in your skin, the Skin can be used on your skin safely and effectively and bring about beautiful results. So I'm trying to answer questions here. So how many treatments are recommended? That's a really great question that does vary from person to person, because what Skin Pen does is it corrects, but it also gives you ongoing collagen stimulation. So there's no true endpoint to when you may want to stop doing Skin Pen if you are really looking for long-term rejuvenation. If you're thinking about, I love the glow and the immediate refresh, as well as the pore tightening that Skin Pen gives to me, because those are really great outcomes from a Skin Pen treatment. Keep in mind that those pores are true anatomic structures, and they're going to kind of want to come back. And so if you don't ever really want to see them again, then doing Skin Pen pretty regularly will make sure that's the case. If we are really trying to correct a pigmentation disorder or scarring, or you're really wanting to improve wrinkles around the eyes, around the mouth, then we would recommend about 5 treatments to kind of get you to goal. Primarily because this is something that doesn't take very long with no significant recovery period, so it's going to take more treatments to make a more significant type of improvement. However, if you're really looking for a pore tightening, beautiful refresh, some people just come and do 1 treatment a year. There's no one way to do it. Another question, is this the same as a vampire facial? So that's a great question. When we combine microneedling with PRP, or platelet-rich plasma, then yes, this is the vampire facial. I think the celebrity that may have made the vampire facial a little bit more of a Instagram famous was Kim Kardashian. Famously did a vampire facial. She did have beautiful results from it, and she'll tell you that, but it's kind of hilarious that she, of all people, made it Instagram famous. Platelet-rich plasma I'm going to be talking about in detail in the next hour of our live segment. And platelet plasma, or PRP, is something that we actually draw your blood when you get here and we spin off that platelet plasma. And instead of the gel glide that Carly is using right now, we use your own platelet plasma. So as you're having your microneedling treatment, you're having your own growth factors really driven directly into the skin, so you have a more dramatic result and a more dramatic direction in even one treatment. So PRP is really like a heavy lifter here at TLC. It has a phenomenal safety profile and can be used in so many different ways, whether I'm trying to rejuvenate skin or I'm trying to grow hair. PRP is literally like my right-hand man. So how is Skin Pen different than Genius? This is a great question because it's a little bit of a misnomer. If you were able to see the live demonstration of the Genius earlier today, you would see the device itself looks very different than the Skin Pen, and the ways it is administered is incredibly different. So it's a misnomer that they share the term microneedling. So Skin Pen is more what we call traditional microneedling. It is a mechanized device that has very precise determination of depth, and they're tiny little needles and we're moving. We're moving, and taking multiple passes in a given area, and there's no heat generated, no heat at all. So those needles don't have any thermal sheath. There's no heat, but it's a great way to correct pigment. Whereas the Genius is a radio frequency microneedling device, and the microneedles are all thermally sheathed, and there's many more needles per application, and it generates heat deep beneath the skin safely to tighten the skin, but does not correct pigment. So they're really, I prefer to even call them by their manufacturer's names to really help minimize that confusion. So we have Skin Pen, we have Genius, think skin tightening, think volume tightening around the lower jawline area, and correction of hyperhidrosis with Genius. Think pigment correction, pore refresh, scar treatment with the Skin Pen. Okay, next question. Post-procedure products. We're pretty consistent here with our post-procedure products because we do have really fantastic and very predictable results with the Elastin nectar. So that's typically our favorite kind of go-to post-procedure product. It does have the most data to support its mechanism of action and how it helps clear out the debris that sometimes is stimulated by a treatment. That being said, you're really kind of dry and peely for about 48 hours after microneedling treatment. So using a very bland moisturizer can kind of help you through that. It may not do quite the same level of rejuvenative benefit that Elastin Nectar can, but it will help and carry you through that dry period. Some of my favorite moisturizers are the Dr. Rogers cream and the Dr. Rogers lotion. And for very, very, very dry areas, I like the Dr. Rogers healing balm, restored healing balm. Importance of SPF after treatment. Yes, of course. We're going to recommend this after just about every single treatment here at Dermatology Ladies Center in Chapel Hill. But yes, we have effectively during a microneedling treatment, we have removed that kind of top layer of crud that does help reflect some UV rays. And so we really want you to be very diligent with your SPF after treatment. So here we are. How's it going? Okay, feels great. So Diana did have 30 minutes of numb gel before we started. So she's actually totally comfortable. If you don't have time for that numb gel, you can elect to do Pronox. Pronox I talked about earlier. Sorry, I keep adjusting my goggles. I'm talking so much they're fogging. That doesn't usually happen when I'm treating patients, so it's kind of funny. So Pronox is actually 50% nitrous oxide gas, 50% oxygen, totally patient controlled. You hold on to your own tube, and that can be used as an analgesia option if you don't have time to numb. And this is a great question. Can you do BBL and Skin Pen together? And the answer for that is we routinely do BBL and Skin Pen together. That is a routine combination. It is my favorite combination for acne scars and even pigmentation disorders because we're able to treat the pigment or that the acne scarring in two ways at one time. And you get it really deliver a lot of energy into the skin in the most effective way possible. And then what would happen is if you actually first come in, you have BBL first to the entire face or face, neck, and chest on the areas that we're treating. And then microneedling follows behind it, and you can do face or face, neck, and chest with your Skin Pen as well. And that way you get that deeper rejuvenative benefit of the Skin Pen, but then you get that color correction and that energy delivery, which is a different type of collagen stimulation from the BBL. So for more severe acne scars, if you can think about the rolling scars, the deeper, broader scars on the cheeks, that is when I might pull in my Genius device as a better option to address that deeper scars. That being said, we do BBL and the Genius together routinely for addressing those concerns as well. Again, if you're going to already be in here, we want to try to get you as far as possible. Let's see, another question here. Is it okay for the face if I had a negative reaction for PRP with my knee? That is such a great question. And the answer is absolutely yes. So the PRP, I'm glad you brought this up. I'll talk about it now, and I'm going to talk about it again in an hour because I think that this is a really great question. And PRP was first developed in the orthopedic literature. They've been using it and refining their technique, honestly, to help regenerate different types of the soft tissue aspect of a joint and to stimulate bone growth in joints. And then that's when it leapt over into the dermatology space, where we use it to rejuvenate skin. We first used it in wounds, and then it moved over to regrowing hair, and now to regrowing skin and rejuvenating skin in the aesthetic space. So we use it kind of in so many areas of medicine. If you take all that body of literature together, it's enormous. But it's pretty hard to regenerate a joint. So the yield from PRP in the orthopedic space is lower than the yield it is in dermatology space. And so even if it didn't work for your knee, it can very well work for your skin. So now it is time for us to roll it back to Leanne so you can hear more about our specials and how to win our awesome raffles.
Yay! Welcome back. We're approaching the end of our 1 o'clock live hour, so thank you so much for tuning in with us. I'm going to preview to you what's happening next at 3 o'clock for our live hour. We are going to have our product experts here with Adigun, which is one of our medical grade skincare brands. We're going to be demonstrating laser hair removal. We're going to also be demonstrating filler in the lower face chin area and the Genius for excessive sweating. So for all of you who are interested in how to treat your hyperhidrosis or excessive sweating in the underarms, this is for you. We also have our product expert here in the house, Ryan, with Elastin. He's amazing, okay? Coming to this event is worth it just to talk to Ryan. So get all your Elastin questions ready for him. We're also going to be demonstrating a halo with PRP or platelet-rich plasma. So our last hour is jam-packed with all kinds of exciting things. I look forward to seeing you then. As a reminder, all products are 20% off. Purchase of a skincare product gets you entered into one of our 5 incredible raffles. Every product you purchase is one raffle entry. In addition, we're still selling event vouchers today and tomorrow. That's a $250 deposit that guarantees you the event specials until November 13th. Those specials are 10% off package treatments or 20% off single treatments. If you have any questions, don't hesitate to ask, and we'll see you again at 3 o'clock.
Achoo!